Hello everyone. Am I audible and visible? Let me know, then we'll start. Am I audible? Let me know. Am I audible and visible? Okay. Am I audible and visible? Fine. Hello everyone. Welcome to Unacademy Future Doctors. I'm myself Dr. Dipti and I am your faculty for Physiology. Let me explain in brief about our subscription. We have two kinds of subscription. One that is plus subscription. In this, you can choose the best from the best. Here, you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access question bank, which is having more than 25,000 questions. You can compete in the live test as well as quizzes, and with 12 months and above subscription, you will get printed notes too. Second is our iconic subscription. Here, your access to the best from two of the best, and the two are one is Unacademy and Prep Ladder with Unacademy. All the features I have explained, and second one that is Unacademy and Prep Ladder with Prep Ladder. Here, you can have clinical and integrated essentials. You can have video lectures from the Dream Team, Question Bank 3 with active guidance, system tags, and more, rapid revision and snapshots and treasures, and 2021 Dream Notes. Also, we have added certain features in our special class. We made the class interactive and live. You can poll for the learner. We also have added the feature that is the raise a hand. Here you can talk to your educator in live class. You can never miss a class as you are always notified for your class. You also can download lecture notes. You can download PDF notes for your all the lectures, and you can access your classes anywhere and at any time. Also, we have updated and highly effective question bank. This question bank is having more than 25,000 high-yield clinical questions. These are based on the latest exam pattern, and also it includes detailed explanation too. These are our NEET PG 2021 toppers. Also, we have started our Focus FMG 2022 comprehensive batch, that is from 15 December 2021, that is for 6 months, and Target NEET PG 2022 test and discussion batch, also from 15 December, and that is also for 3 months. Okay, now, so you can subscribe from your mobile, either plus subscription or iconic subscription, and you can use my code DIPTI10 and you can get 10% extra discount. Okay, now there is one another important thing which I would like to share with you, that we have an option of take a quick quiz. You can see here, you can have a quick quiz. You can see how to enter. You just can open your app. You just I'll show you it again, that just a minute. Join quiz, okay, and you can enter the code. This is my today's code for the quiz for cell physiology. So you can join the quiz by entering this code, and the code that is 473514. You can use this code and you can join the quiz. Okay, so this is your code for the quiz. So whatever you learn, you just can gain by joining this quiz. You can see here, this is the code, how to enter 473514. Okay, and you can join the quiz. Okay, fine. Now, let us come to today's topic. And our today's topic, that is principles of family practice. Okay, one of the important topic of foundation course. Okay, now what is this role of foundation course? I think all of your admissions have been started. So once you get your admission in the medical college, for first month you will be having foundation course. Now, what is this foundation course and what is its importance? Hmm? Foundation course means you are making your foundation base of the medical field for that, because this is just a new thing for all of you. So you all have to familiar with that medical studies, because as I told you, here we are not dealing with the machines, we are dealing with the subjects, okay, living individuals. So whenever you are dealing with the living individuals, you will be having so many problems. Because you have to deal with the emotions, you have to deal with the psychological changes of all those individuals. So in this foundation course, you will be taught certain topics, and these topics will be very much helpful in your medical practice. How? What is the role of foundation course in medical practice? Okay, practice. Okay, suppose you are pediatrician, or you in your future you will be gynecologist, or you will be general physician or neurophysician, or any specialty or super specialty you select. What happens whenever you become either a specialist or super specialist anywhere? You have to be in contact with the patients. Okay, so this is, you will be, you can say, family physician. It is a kind of family physician. Physician means the person who treats, and family means, suppose if some patient comes to you, other family members as well as they all have a trust in you, then only they will be coming to you for the next time and all. Okay, so here this foundation course, certain topics will be taught to you. They are very important in your practice. Why are they important? I'll tell you. Because nowadays you must have heard that doctors are beaten by patients or relatives of patients. Huh? This is happening so many times. What is the reason why this happens? Why doctors have been beaten? Doctors are beaten, as well as our resident students are beaten by the patients and relatives of patient, because we are not knowing how to deal with the patient. So here in this foundation course, you will be taught how to deal with the patient in different situations. Okay. So here, let us start with the principles of family practice. Here, principles are: one is caring. We will discuss one by one. Then clinical competence, cost effectiveness, continuity of care, comprehensive care, common problems, management expertise, coordination of care, community based care and research, counseling and communication skill, continuing medical education. Now, another important thing here, new curriculum, NMC guidelines. According to NMC guidelines, this foundation course and all these things are must for you people. In some of the universities, questions also will be asked from these topics, and you are not getting all these topics in any of your books. So if you are reading as well as if you are preparing notes from these topics, this will be your scoring topics. Okay, so these are not very tough to answer. These are just a matter of some things which you have to apply. Okay, so now starting with the first, caring of the patient. Okay, here, so what is caring? That is humanistic way, because we all are human being and we have selected uh, this profession as a base of humanity. So this is humanistic way to interact with patient. Okay, so to interact with patient we have to be human. Okay, and as well as it also deals with, that is to demonstrate sincere care as well as concern for the patient. Okay, because we are not treating, as I told you, we are not treating machine, we are treating patients. Okay, so this is first principle of family practice, that is caring. Second is clinical competence. Clinical competence means, what is it? That is ability to provide safe care. As I am telling you, all these things will be asked in your exams as a question sometimes, as well as in your practice. This is very important. So what is clinical competence? So these are the principles of family practice. Okay, these are the principles of family physician, practicing as a family physician. Okay, now clinical competency means it is the ability to provide safe care to the patient, and by this competency we can improve quality of patient care. Okay, we can improve the quality of patient care, and we can also increase satisfaction of patient. Okay, so that is clinical competence. Third is cost effectiveness. It doesn't mean that we have to treat free of cost, but cost of effectiveness means to identify the strategy, we have to use the strategy that provides best value for both patient and society. So we have to give good outcome, better outcome at low cost. Okay, this is the aim of this cost effectiveness. Then continuity of care. Continuity of care means it is the quality of care over a period of time. Over a period of time. Okay, so it is the process in which physician and the team of the physician, it continues to care the patient. Okay, suppose patient comes once to you people, then if he or she is coming for the second time, then that is continuity. You must have to recollect all the things which happened last time, what history was given, what was the other clinical condition. So that is continuity of care. And what is the use of this? That is to provide high quality, because we are not knowing the situation, condition of the patient previously, what happened, whether suppose some patient is with having high blood sugar, he came 15 days back and now he is coming, and this time he must be knowing that I told doctor साहब के मुझे high blood sugar है, so he may have forgotten, but you have to know. So whenever you are prescribing or you are advising the patient, that is beneficial. So that is to high quality and cost effective medical care can be provided. Okay, now next is comprehensive. Comprehensive means complete care. Okay, because a complete care means, suppose if patient comes with one complaint to you, okay, so it is not just a one complaint. Behind this one complaint there is bundle of other things. Okay, for example, suppose patient is coming having high blood sugar. Okay, so it is just a complaint, but along with that, which are the other things? Sorry, high blood sugar. So this is just a complaint, but along with that you have to look after other situations, like whether family history of diabetes, okay, lifestyle, whether the patient is taking healthy food or not, okay, whether the patient is doing regular exercise or not, whether the patient is taking stress or not, okay, whether the patient is having any hidden stress which he is not knowing. Okay, so this is comprehensive. This is just a high blood sugar is a manifestation, and this is the root. So this comprehensive care, that is used for the prevention and management of the disease. If we are giving this care also, we can prevent the disease too. Okay. Then next is coordination of care. In this coordination of care, we have to involve patient care activity as well as we have to include other family members also. For example, suppose patient is having high blood sugar, as I told you. So in coordination care, what we have to do, we have to ask for all these factors, whether family history is there, whether lifestyle, whether the person is doing exercise, whether there is any stress to the patient. Then ask the family member regarding all this and ask the family member to reduce this causative factors. Okay, ask the family members to reduce the sugar intake. Okay, so this way, this is coordination of care. Okay. Next principle is community based care and research. So here, this is just the name itself suggests we have to gather the data and understand and protect and understand and provide public health to the regarding certain diseases. Okay, so we can aware the subjects also, patients also. Then next very important thing is counseling and communication skill. Very important for a doctor. Why? Because counseling means some things, if you have to make it convince the person, other person, you fit your ideas in the brain of somebody else, that is counseling. And to counsel the patient, we must have communication skill. We must first listen, understand, and then give the solution, and then make that things in the brain of the patient, to fit that thing in the brain of the patient. Okay, so here we must not be judgmental always, every time. We must have to be attentive. We have to be we have to listen. Okay, we have to clarify the things in our mind first, and then we have to counsel the patient. Okay, then next is continuing medical education. This is also a part of doctor's life. We have always to update ourselves. Okay, because medical field is always updated. So if you are not updating yourself, then what happens? You cannot treat the patient well. So always be a part of conferences or certain magazines which is having recent advances. So all this update your this knowledge. So that is also one of the important thing. Okay, now, so family physician, you can see whether you are pediatrician, gynecologist, physician, surgeon, family physician, any of you. So he or she is a doctor having medical practice or specialty which provides continuing general medical care for not only individual but for the family also. Okay, he also supervises healthcare activities. He also provides comprehensive and holistic care to the patient and the relative. Okay, as well as he or she works for the health of society. Okay, so now sentence by Professor David Metcalf, that is a well-trained family practitioner, can manage well most of the problems that most of the people have most of the time. So this is treated by family physician. Okay, now for this there are 5 principles. As we have, some of them we have discussed. One is compassionate care, we will discuss in detail. Second is generalized approach. Third is continuity of relationship. Fourth, reflective mindfulness. And fifth, lifelong learning. Okay, we will discuss one by one. First is compassionate care. Compassion, that is attitude. So compassionate care, that is caring attitude for the patient. Caring attitude for the patient as well as family of the patient. Okay. So here this is internal. This is not as a part of mercy. We have mercy on the patient, or as a part of our duty. It is not like that. Or we are as a fear that we will lose our patient. Not because of any of this we have this care, but as we have selected this profession which has humanity, and for that purpose we have to care. We have to have caring attitude to our patient. Okay, this is one of the very important thing for being successful doctor. So this is also one of the very important thing, because you, once you get admission in the medical field, definitely you will be becoming doctor. But to become a successful doctor, certain qualities you must have. If you don't have all these qualities, you just can get the degree, but you cannot be a successful doctor. Okay, why? And one of them, that is compassionate care. Okay. Now next is generalized approach. That is, generalized means we have to approach illness not only of the patient but family and society too. So sorry, this generalized approach, it focus on the whole people, whole society, instead of particular person. So it's a field of vision that is contest of illness of not only person but the family and the society. Okay, so this generalized approach, it has like it is concerned with other factors too. For example, as I told you, suppose some patient came with you with some clinical feature. So you have to correlate it with other factors, like what is the age of the patient, what is the socio-economical status of the patient, because some diseases are common in some socio-economic status. What is stress situation of the patient? Okay, what is the lifestyle of the patient? So this all is to be taken care. Okay, now so this generalized approach, it is also based on clinical experience. Okay, so we can get easily this by our clinical experiences. Okay, next is continuity of relationship. Continuity of relationship means it is the relationship between patient and doctor. Okay, or family physician and doctor, and this depends on trust, depends on bonding, depends on your behavior and responsibility. Okay, if your behavior is not such that the patient can put trust on you, can be bonded with you, then your doctor patient relationship cannot continue for a long time. Okay, so this is interpersonal relationship which is developed over a period of time with repeated visits with the same doctor. Okay, so suppose some patient is coming to you repeatedly, then you are knowing so many things about the patient, like some allergy, suppose some body constituent, some health related issues, some thing about the nature of the patient, whether the person is taking stress or whether the person is not taking, what is the body build. Okay, so this all, they help you to treat the patient. So this is continuity of relationship is also very important. So many times I think you also may have experience, your elders or your parents tell that if I go to this doctor I'll be fine. Why is it so? Each and every doctor treats, but why? going to that particular doctor, the patient feels that he or she is very nice, very fine, because of this trust bonding. Okay, so these things are very important, and they are very much helpful for your practice when you start your practice as a physician. Okay, now next is reflective mindfulness. Reflective mindfulness means you are aware of your thoughts and emotions. Means suppose you are emotionally disturbed. Okay, that should not affect on your behavior or your treatment to the patient. You have some emotional disturbances either with the patient or with the relatives or with your family. Suppose you have some conflicts with the relative of the patient. Okay, now your patient comes to you. So what happens? That should not affect your behavior, your treatment to the patient. So this is reflective mindfulness. So that refers to doctor's awareness of personal thoughts and emotions. So it is the sense of presence of curiosity and attentiveness towards the self as well as towards the other. In stressful situations also, doctor must think meaningfully, mindfully. Okay, so this is reflective mindfulness. Okay, and last but not least, lifelong learning. Doctors are lifelong learner because in medical field every time new things are coming. So if we are not updated to this new knowledge, we cannot benefit our patients. So to give maximum benefits to our patient, we have to regularly attend conferences, CMEs. We have to regularly update our knowledge regarding new diseases, new treatments, new drugs. So this is also one of the very important thing that is helpful. Next is 4 principles of family medicine. That is, family physician is a skilled clinician. How skilled clinician? Because family physician use all the aspects to treat the not only the patient as we have discussed, but to the family and society. Okay, how all the aspects? Because the patient is continuously coming to you, okay, every time. So you are knowing about the patient. You are completely knowing the history and other things of the patient. You are knowing about the family members, some of the history, okay, and the society from which the patient is coming. So you can say family physician is a skilled clinician. He or she can use all the aspects to treat patient, family, and society. Okay. Second thing, family medicine is community-based medicine. Means community-based medicine or discipline means you are treating the whole community. Suppose if you are practicing somewhere where you find that iodine is deficient, so you are getting patients having goiter more. So you can come to know that this is mostly commonly because of iodine deficiency in the soil, in the water, and in the food. So by that way, you can treat the whole community. You can give this information to the healthcare, higher healthcare, to provide iodine in the salt or in other ways. So this family medicine, that is community based discipline. Okay, so you can use your this knowledge as well as the number of patients coming to you. You can get the idea and you can help community too. Next is family physician is a resource to define practice population. Okay, so here suppose some population is at risk. So family physician, because he is in contact with the population, He can easily find out which population is at risk. For example, some workers are working in some industries, so they are more common to risk of certain diseases. Okay, so this is easily identified by family physician. Okay, and he or she can send this message to the higher authority. So this can easily be understood as well as treated by the health team. Okay, and last but not least, that is patient physician relationship, that is having central role of family physician. Okay, because this relationship is must. If your patient doesn't trust you, your patient does not have the bonding with you, okay, then he or she will not be comfortable. You cannot easily treat that particular patient. Okay, so this things, patient physician relationship, that is also play an important role in the family practice. Okay, so this is all about our today's topic. Okay, that is principles of family practice. Thank you. If you like my video, you can like it, share with all your friends, and you can subscribe our channel Unacademy